Welcome to today's explainer. We are jumping right into the clinical science, the incredibly precise techniques, and the absolute must-know safety guidelines of manual lymph drainage. If you're working in the clinical space, you already know this is a highly specialized arena. So today, we're cutting straight to the core of physiological mechanics and medical protocols that make this therapy so powerful, but also, if used incorrectly, potentially dangerous. Let's get into it.
Okay, here's our quick roadmap for today. We're going to hit the origins of lymph drainage, move into decongesting the lymphatic system, break down the gentle Vodder technique, cover those strict and relative contraindications, and wrap up with indications and decongestive therapy. Section 1. The origins of lymph drainage. It's actually kind of wild to think about, but back in 1932, Dr. Emil Vodder started intuitively working with people who were suffering from chronic colds. Now, at the time, manipulating sore, swollen lymph nodes in the throat was completely taboo. I mean, totally off limits. But his techniques worked. Fast forward to the 1960s, and Dr. Asdonk brings rigorous scientific validation to the method. That validation is actually what convinced the German system to recognize it for medical reimbursement. Later on, the Földis, Michael and Ethel, saw that while MLD was brilliant for fluid mobilization, it really needed to be part of a bigger system. So they made it a cornerstone of what we now call Complete Decongestive Therapy. Moving right along, Section 2, Decongesting the Lymphatic System. All right, so here is a non-negotiable rule of anatomy. You literally cannot treat superficial, swollen extremities without first decongesting the deep visceral lymphatics to clear a pathway. The superficial system drains into the deep system, right? So if you want to relieve a swollen arm or leg, you have to clear the central proximal areas first. You're basically clearing the highway before you open the on-ramp for all that traffic to flow. And this is where the physiology gets absolutely fascinating. Drawing tissue fluid into the lymphatic system actually triggers a powerful natural diuretic effect. It sounds completely counterintuitive, doesn't it? You'd think increasing lymph production would just mean more swelling. But by pulling interstitial fluid into those lymphatic vessels and circulating it back into the venous blood, we intentionally overload the venous fluid volume. The body instantly recognizes this excess and it safely diureses it out through the kidneys. We're essentially tricking the body into taking out its own trash. It's just an elegant, natural cleanup process. Section 3, the gentle Vodder technique. Now listen, manual lymph drainage is absolutely not traditional massage. Traditional methods use skin gliding, friction, and deep stimulation to create hyperemia, increased blood flow. But with MLD, you have to actively avoid all of that. Instead, you're using gentle skin traction and circular stretching. And here's why this matters. The lymphatic system is incredibly delicate. Abrupt, deep stimulation, that can actually cause lymphangiosspasm, which completely disables the vessels. You've got to protect those fragile anchoring filaments and the capillary plexus at all costs. Which brings us to this really beautiful mechanical reality. Because the lymphatic network is a closed hydraulic system, whenever a lymph vessel segment, or lymphangion, contracts, it fills the next proximal segment, while simultaneously pulling fluid from the distal segment below it. During the feather-light resting phase of each Vodder stroke, you're creating a passive distension of the tissue that yields a literal vacuum effect, suctioning fluid from the periphery right up to the capillary plexus. I want you to think of your hands as a metronome. The resting rate of a lymph vessel is only about 6 contractions per minute, but by applying these slow, predictable, wave-like strokes, about 1 per second, you rev that resting rate all the way up to 20 contractions per minute. Plus, because the rhythm is so consistent and gentle, it triggers a massive systemic relaxation response that offers incredible analgesic relief for patients dealing with severe pain or hyperalgesia. All right, Section 4. Strict and relative contraindications. We literally have to respect the body's reasons for swelling. Take congestive heart failure, for example. The body is intentionally storing fluid in the legs because the failing heart simply can't handle the venous return. Pushing that fluid centrally is strictly prohibited. Same goes for renal failure. Shifting massive fluid volumes back to kidneys that can't process them, highly dangerous. And with acute infections like cellulitis, manual manipulation can rapidly push microbes through a sluggish immune system, turning a local issue into a full-blown systemic crisis. Oh, and acute DVT is a strict red flag too, for obvious reasons. We do not want to dislodge a clot. When treating the neck, you need specialized vigilance. Hyperthyroidism is a strict contraindication because you really want to avoid dumping excess thyroid hormones into the circulating blood. If a patient has a cardiac arrhythmia, avoid any vagal stimulus. And crucially, for patients over 60, there's a higher statistical risk of arteriosclerotic plaque in the carotid arteries.
Now, MLD stays at the skin level, so it's unlikely to dislodge a plaque, but clinical safety dictates we omit those specific deep neck techniques entirely, just to be safe.
For abdominal work, we're looking at two distinct camps. Strict red flags mean absolutely zero deep abdominal manipulation. That means history of abdominal aortic aneurysm, pelvic DVTs, green filters, or unseen internal radiation damage. For post-op patients, you wait at least 15 weeks for deep tissues to heal. Then you have relative concerns, pregnancy, menstruation, or Crohn's disease, which require careful clinical judgment and, honestly, often mean omitting the abdomen entirely. But here's the major takeaway. If abdominal manipulation is a no-go, you can always substitute it with safe, effective diaphragmatic breathing to get similar lymphatic benefits. And finally, Section 5, Indications and Decongestive Therapy. Zooming out, MLD is incredibly versatile. Anytime there's a mechanical failure of the lymphatic system, it speeds up the clearance of proteins in post-surgical or post-traumatic tissues, actively cutting down healing time. It's also a game changer for complex regional pain syndrome, or CRPS, because it addresses both the mechanical strain of the edema and provides that much-needed analgesic relief. It even supports systemic diseases with an edema component, like rheumatoid arthritis. But, and this is a big but, we have to look at the whole picture. Complete Decongestive Therapy, or CDT, is a symbiotic umbrella. MLD is just one piece of the puzzle. The Földis figured out that with MLD alone, you get very poor long-term outcomes for chronic lymphedema. But without MLD, you also fail. These modalities rely entirely on each other. Here's exactly why they're a package deal. If you just slap a compression bandage on a swollen limb, you're essentially just forcing venous water back into local veins, leaving all those thick, protein-rich fluids trapped in the tissue. This causes what we call the pumped limb effect, which actually promotes fibrotic tissue damage. By using MLD to clear the deep central tissues first, we wake up those systemic pathways. Then, when you apply compression, those vital protein-rich loads actually have an open road to evacuate. So I'm going to leave you with this final thought as we wrap up this explainer. Since this incredible technique is really just one cornerstone of a much larger structure, how will you integrate these precise physiological mechanics alongside the other therapies in your toolkit? Next time you're building a complex treatment plan, remember, sometimes the lightest touch yields the absolute most powerful results. Thanks for hanging out with me for this deep dive, and keep seeking those deeper understandings